Okay, this is being recorded for use by Dell sales team in Europe to be able to present to HSE as a joint value proposition between from Core Mobile and Dell. What Core Mobile does is we improve efficiency, patient experience, and outcomes by enabling a unified patient experience all the way from the time the patient is scheduled to the scheduling of the resources and the staff at the care center to the patient going into pre-op, intra-op, post-op, post-discharge to rehab, and then leading on to automated ways of measuring the outcomes. The company was started based on founders' personal experience with son going through surgeries and the shortcomings that were there in the healthcare system. The company was started in 2011 with seed investment from Citrix and then subsequently partnered with Dell for go-to-market. What we do is we harness the power of mobile real-time data and machine learning to improve operating room and operating theater efficiency and enable healthcare providers to engage with patients throughout all stages of care, right from the point that they are being scheduled to go through surgery or scheduled for any procedure or scheduled for a clinic visit. It takes care of that all across stages of care from the beginning all the way to the end until the patient is recovered and either is at home or in rehab. The way it is achieved is by using smartphones, tablets, wearables, and computers, as well as large screen displays kept at key places in the hospital. The company was started with seed investment from Citrix, as I said, backed by Citrix completely and partnered with educational institutions and SAP and Dell for go-to-market. The place where it started in 2011 to where it is now, it's employed at some 10 plus major hospitals. 30 more hospitals are scheduled for deployment this year. Each of these hospitals are large hospitals with 200 plus beds, 6 to 20 operating theaters, which includes general anesthesia and complex procedures in cardiovascular as well as cardiothoracic surgery. And in addition to that, it also covers minor procedure rooms where either the patient is getting moderate sedation or no sedation at all. Most of these procedure rooms in each hospital varies between 11 and 30 depending on which hospital you talk about, and covers specialties all the way from orthopedics, cardiology, neurology, gastroenterology, radiology. So it covers a wide variety of specialties across the hospital depending on which hospital you talk about, between 15 and 20. All of these hospitals, by the time we got there, we had gone through enough trials to show successful deployments, and all of these testimonials are available via videos, statements, and we have end users who are ready to take in-person calls at any time. Why we came to Ireland this year is as we started to expand out of United States, we selected Ireland as the European headquarters, which is where we are filing all of our patents that have been filed in US. They are being filed in EU based out of Ireland. How it fits in with the strategy with Ireland is that it enables stay left, shift left strategy by improving the quality of life and the quality of care and the care provider's experience of providing the care while reducing the cost. How we do that is by improving efficiency. And the efficiency improvements are measured based on increased patient throughput. So if your hospital is doing 200 surgeries in a month, if they start using this software, they will start doing between 210 and 250 surgeries a month without adding any more operating theaters, any more operating rooms, or any more staff. Similarly, the OR block utilization. So operating room, operating theaters are divided up in blocks between different surgeons. The utilization goes up to 95%. The cancellations and delays come down between 5 and 40%, and that's a result of engaging the patients and doing patient um, prep instruction compliance, and reduced OR turnover times by reducing by improving the coordination in the staff. Now shifting to the right side, how you see is that at the top are all the features that attribute to reducing the cost and improving the quality as well as improving quality of life. And the bottom one are all the features that are included in the technology which improve the healthcare provider experience, not just the patient experience, but the provider experience as well. So if you go top to bottom, the first step is when a patient has to go through a certain procedure or a certain surgery, or has to take care of themselves, it's best to educate the patient. So we provide features on mobile phones where as soon as patient is identified with a certain condition, the patient education information on its own becomes available to the patient, which is customized for that particular patient on the phone itself, so they can be educated of how to take care of themselves. Not only does it educate them, it reminds them. For example, a patient who has to go through a thoracic surgery is reminded in the morning to walk 3 times a day and use their breathing machine 3 times a day. Similarly, a patient who has to go through a GI procedure or a colonoscopy is reminded to do bowel prep. So these reminders really engage the patient before procedure, before surgery, day of procedure, and then after discharge. So patient education and engagement is a key part of this technology, and it's all included and customized per specialty, per procedure, and per patient. The second step is patient prep instruction compliance. The reason there are so many cancellations, delays, and no shows is because patient is asked to not eat after midnight and they have breakfast and show up for their procedure. Similarly, if they are asked to do bowel prep, they don't do that. If they are asked to stop taking blood thinners, they don't do that. So this is a way by which the patient is reminded that they have to do something, and then they are asked at the end of the day, did they do something that they were asked to do? And whatever they respond, it gets recorded. And if there is a condition like the patient has not stopped taking blood thinners, they cannot go through surgery. So the system generates a message to the care team that this patient is not followed prep instructions. So the prep instruction compliance is a key component of it. Just prep instruction compliance alone is responsible for bringing down these cancellation and delays by between 5 and 40%. The third feature in this area to reduce costs and improve care is to individualize preoperative testing. The preoperative testing takes three inputs. One are the medical rules that are documented in anesthesia books by Roizen, Miller, and Barash. That's one input to this engine. The second is the questionnaire that the care provider fills out for the patient. And the third is the questionnaire that patient himself fills out, himself or herself fills out. For example, if the patient says the patient is able to climb 3 stairs, 3 levels of stairs, 3 flights of stairs, and then they don't have to go through an EKG because they seem to be doing fine. So it individualizes preoperative testing for that particular patient based on what procedure they are going to go through. The reason this is important is if you do too much testing, the cost goes up. If you do too little testing, there are going to be delays on the day of surgery. So that's a key feature that improves the quality of care while reducing the cost of care. Then there is care team coordination. The care staff, the staff that takes care of the patient before surgery is different from the staff that takes care of patient on the day of surgery, after discharge, and then in rehab. So how do you coordinate the care across that team? The patient cannot remember who they have to communicate with. The software takes care of that. The patient just touches an icon and is able to send a message via voice to text, images, and videos to the care team, and the system in the back end takes care of routing those messages to the appropriate care team member based on what stage that patient is at. Is it pre-surgery, day of surgery, post-operative, or post-discharge, or in rehab? So that fourth feature of care team coordination directly leads to reducing the cost of care and improving the quality of care. Then there is discharge instruction compliance, which I talked about earlier. Once patient is discharged, they need to be able to follow the discharge instructions. If they don't, they fall more sick and they get readmitted. That increases the cost of care, reduces the quality of care. So in this case, by doing proper discharge instruction compliance, by the application providing reminders and tracking that they are actually doing what they are asked to do, directly reduces readmissions and improves the quality of care and the quality of life in general for the patients. Finally, patient reported outcomes. Patients, if you ask them to fill out a questionnaire with 19 questions, they are less inclined to do that. But if you ask them one question in a day, they respond to it more easily or more willingly. So you slowly over a period of time not only get to have patient fill out surveys but also measure their outcomes. What is their pain level 5 days in a row or 5 weeks in a row, whether they have any side effects, whether they have any symptoms. You can ask them those questions and collect that information, and then the system collects that and automates the process of measuring the outcomes. So all of these six features really attributed towards the patient education, patient prep instruction compliance, preoperative testing, care team coordination, discharge instruction compliance, and patient reported outcomes. All of those lead to lowering cost of care and improving quality of care and improving quality of life of the patients. Now come down the below the line is more features that are related to improving efficiency at facilities. The first of them is optimize the patient scheduling, the staff scheduling, and the theater and room scheduling. Have graphical view of which patient is scheduled in which facility for what type of procedure, and this is assisted by analytics. The system keeps track of how long a typical procedure has taken for a certain surgeon to perform that procedure. So next time if the scheduler schedules less time, the system pops up a message saying it takes 4 hours, so don't schedule 2 hours. So there are less cases that run over and upsetting the schedule for everyone. This really optimizes and streamlines the operation of every facility by optimizing the scheduling for the patient, for the staff, and for each of the resources at hospitals. The second feature is dictation based clinical documentation for everybody, for nursing, surgeons, and anesthesia. The staff spends so much time doing charting on computer that goes away. In this case, on a mobile device, on an iPad, on an iPhone or an Android phone, or even on a desktop, the staff can actually speak, and that gets translated to text, and whatever is translated to text, that goes through another engine, which is natural language processing, which automates the translation to CPT codes and ICD-10 codes. So now you have the entire mechanism of putting in physician notes, the nursing notes, the anesthesia, post anesthesia notes, which are put into the system in voice to text, and within 30 to 60 seconds are becoming available to rest of the care team. That too after translation to CPT and ICD-10 codes. So your natural way of billing and consolidation of the cost of care gets done automatically without any additional effort. The fourth feature is the automated surgical risk assessments. A lot of surgeons don't run these risk assessment models because they have to go into the EMR to look at the patient information, then manually populate them in the risk assessment model. You don't have to do that anymore. The software takes care of that mundane task. It reads the patient information from electronic health record and then populates the surgical risk assessment model so the surgeon can see it getting tracked right away. The fifth feature here is patient tracking. Whether patient is in registration area, in admitting, in pre-op, or anesthesia, or in the operating room, or in post-anesthesia care unit, or in recovery, all of that is tracked not only by the physical location of the patient, the RTLS-based physical location, that is done of course, but in addition, where they are in the care process, who finished their task in pre-op, and who finished their task in the holding area. All of those are tracked via one-touch icons, easy to use one-touch icons in the application, so that entire team knows what has been done on which patient at what time. Finally, all of these are covered by the analytics that is collected in real time. There is retrospective analytics on how it was done in the past, and there is predictive analytics. The predictive analytics is one feature that leads to more optimized use of resources as well as patient family satisfaction. So the system can predict what is the estimated time of discharge. So the patient family doesn't have to wait around all day. They get text messages that this is their estimated time of discharge. The second part of prediction is when does the patient reach PACU or when the patient is going to reach ward. And that has huge implications because if you don't have room space in the post anesthesia care unit, you will have to keep the patient in the operating room and then the next case will get delayed. Similarly, if your beds are not available in post anesthesia care unit, um, the patient has to be kept in PACU because the ward doesn't have any beds. So the predictive analytics engine can predict based on how much time it has taken in the past to say this is the estimated time patient will reach a certain place. All of these that the bottom ones really lead to better quality of care, reduced cost of care, but more importantly, better experience of not only patients but the healthcare providers. And that is key to making the entire system efficient and more focused on improving quality of care. The same is summarized here in terms of efficiency measurements. All of what we have talked about leads to very measurable ways of improving efficiency by improving the quality of care by means of reduced readmissions and patient reported outcomes. All of this is done in one integrated system without actually changing your electronic health record. Whether you have an electronic health record, we will integrate with whatever electronic health record you have, as well as if you have two different facilities with two different electronic health records, the system integrates with that. If you do not have an electronic health record and you only have a paper system, we will include an electronic health record for you. So how does this whole solution work in a scenario where you already have a coordinated care model? It really extends that. How it extends that is it starts at the surgery decision time. At the time of surgery decision, the first thing it does is optimize scheduling. It optimizes scheduling by means of making sure the time is aligned for the patient as well as the time is aligned for the resources. So you have full visibility into what resources are available when. And when you schedule that, it does an automated translation to CPT coding. So your billing gets streamlined right at the time of scheduling. Then after that, it goes into a pre-optimization phase where the risk assessments are done, which I talked about in terms of automating the risk assessments. It engages the patients, educates the patients, and then tracks patient prep instruction compliance, as well as optimizes preoperative testing. So all of that is involved in the pre-optimization phase. It includes, say, if a patient has to go through certain lab tests and 1 week before those labs have not been done, it messages the care team this patient doesn't have an HNP current in last 30 days, so there is no way this patient is going to be able to go through surgery, or there are going to be delays. So when you know it 1 week ahead of time, you can proactively take measures to remove that blockage or the reason for the delay. Then on the day of surgery, the surgical event, a whole bunch of activities get enabled in terms of enabling clinical documentation via voice to text, automated ICD-10 coding, patient tracking, staff communication, and support for ERAS protocols. ERAS protocols, enhanced recovery after surgery, has become popular in various different specialties where the ERAS protocol compliance is to be tracked. The system enables the tracking of ERAS protocol compliance without any additional effort. It doesn't require any additional effort from the staff because it looks at all the individual tasks that nursing has to do, the patient has to do, the anesthesia has to do, and the surgery has to do, and it reports automatically the results. And then after that, post-care in terms of post-discharge instruction compliance and surveys and patient-reported outcomes, as they transition out to transitional care, all of that is tracked by the system by means of having this care coordination between staff, which is before, during, and after. So it really is a solution that extends your current coordinated care model, automates it, and measures the impact of it right there in the same system. So how does Dell and Core Mobile work together? Core Mobile provides all the clinical workflow expertise and all of the technology applications. Core Health is a mobile app for iPhone, iPads, and Android devices. Core Patient is for use by the patients and on a mobile device. And then there's a web application and a large screen display, which is Core Periop. And the entire system is managed by a web-based console. So the system is customized per facility, per specialty. All that is done from a web-based console. Dell EMC is the prime contractor, will provide all the existing hardware, new hardware, all the software that we provide will be provided by Dell, and then all the services and support, and the entire infrastructure that Dell brings to bear. So that's how we jointly go out to market to customers in United States as well as in Ireland and Europe.